We're going to talk about a very special place called Whitehall of Boca Raton, and it is a place that does many, many things for people. Number one, you can be sure that if you need any nursing services, you're going to get it there. If you need any rehabilitation, you're going to get it there also. But Whitehall has been there for many, many years, and it is top of the line. I mean, there are a lot of rehab centers that have cropped up. They've taken old buildings and they've turned them into rehab centers. But I've been dealing with Whitehall for a long time, and it's like, for me, like a Ritz-Carlton. It's really very special. But, it's more than the bricks and mortar. What it is it's the people inside and who make it all happen. And I've been so privileged to know Richard Dufour, who is head of marketing there at Whitehall Boca Raton, and he is so enthusiastic. I mean, there's never a dull day. If it's a bad day outside and you say, gee, it's cold, he says, no, it's a beautiful day. It's this, no, it's great. So that's just your personality, Rich, isn't it?
It is. It is.
You always see the bright side of everything.
You have to. You're in healthcare.
Yeah, right. And, and the fact that you're in healthcare, I think you realize in this weather we're having, a lot of people, especially older adults, are having respiratory problems, whether it's from the flu or from just colds or bronchitis. And that's really serious because if you can't breathe, you can't live.
Right.
And so you're very thrilled about bringing on Rena Shannon, who is really what we call respiratory therapist. And why don't you talk a little bit about her first before we go in?
Rena is the director of respiratory therapy at Whitehall Boca. She's been there for many, many years. Rena is an exceptional employee. She is a phenomenal therapist. She's fabulous with the residents, the patients, the doctors, and the families. She's a true asset to Whitehall Boca.
So, Rena, you have to like people first, don't you?
Yeah, you really do.
Older people especially.
Well, I've been dealing with the elderly and working in healthcare I've been a respiratory therapist for 35 years.
Now, in order to be a respiratory therapist, what are the kinds of courses that you have to take?
Well, you have to take anatomy and physiology. You have to take process of the disease, follow the pathophysiology, know respiratory, your lungs, all the anatomy, anything that stimulate allergies, where asthma, COPD, emphysema. We deal a lot with neurological issues, people with neuromuscular problems that will affect their breathing. So it's a varied classes that you take to really deal with respiratory and the cardiopulmonary system, because cardiac and pulmonary go hand in hand.
So when you were going to school and you had so many choices, what made you choose this field?
I just like the fact that at a time when I started, it was a good way for me to have a nice career, a career where I could use my brain. I got to think, and I got to go in and look at a patient and go step A to step B to step C, and this is what happened to the patient, and this is what is happening to them now. So in order for me to combat, I need to do 1, 2, 3. So it let me, really think and use my mind and learn to care for the patient. And the patients are very appreciative.
Oh, I'm sure they are. So let's start with someone comes in as a new patient. Let's not even do the as the rehabilitation. Let's say it's someone who's coming to live there. What are you going to find out so that you'd be able to help them?
Well, the first thing I do is I go in and I go through their medical record that came with them to the hospital, and I look to see, what was their hospitalization, why were they there? And then I look to see, do they have a history of respiratory issues? Were they a smoker? Did they have asthma? Do they have a history of severe allergies? Then I look to see, were they already on any type of treatment? Was there something that they were doing in the hospital? If they were they doing it at home before they got there? Because if you have a patient come in that is on breathing treatments and oxygen at home, then of course that has to continue with them when they're at Whitehall, either on a short-term basis or a long-term basis. So I first do all my information gathering. And then when I do all of that, then I go meet the patient. and I assess the patient, and I get to know them a little bit, and they can tell me, oh, I've had COPD for 10 years, and I take my treatments, 4 times a day, and they're very versed in their treatment. And so with those patients, I know then that they're going to tell me the minute they sense a change in themselves because they've been living with this day to day. So if they come in with a diagnosis of respiratory, either, as their primary diagnosis or their secondary, then I round on those patients daily. Some days I'll just stick my head in the door and say, hi, how you doing? It's Rena. How you breathing today? And they may say, oh, I'm great. Everything's fine. And then 3 days down the road, they may say, Rena, a little heaviness today, a little harder to breathe today. I'm not feeling quite up to par. That's a good sign for me to do a further assessment. And we'll do a chest x-ray. We can do the lab work that needs to be done. Follow up on everything without them being sent back to the hospital. This way they can stay at Whitehall and continue their therapy and build their strength, but in the same time, we're dealing with the other issues that they may have at the same time.
Well, Rich, you must be. I understand why you brought Rena here. She's one smart cookie, as they say.
She's fabulous.
And so when you're out there marketing, of course, for Whitehall, is this a very important aspect to tell people that you have a very strong respiratory department?
It is. You definitely would rather go to a facility with respiratory in-house versus, let's say, just nurses doing the respiratory. Because Rena, like she said, has been doing this for many, many years. Rena can spot a problem head on before it even begins. And that's so important versus a patient that may go to a facility that does not have a respiratory therapist, where the nurses may not follow up as much as Rena does. And then down the road, there's a major problem. And then they have to go back to the hospital. So Rena does a phenomenal job at what she's fabulous.
So, Rena, let's talk about that. So a facility that has a nurse, tell me what the difference would be that a nurse would do, a typical nurse, and your department.
Well, nursing is there to care for the overall patient's, care and stay in the facility. Respiratory therapists were more of a specialist. So our training is more focused on respiratory and cardiac, where nursing is about the whole system. So we're more specialized. So and the nurses are very, very good at Whitehall. They will call me. They call me up and go, Mr. So-and-so just isn't quite himself today. Would you just come up and take a quick look at him?
But let's say that there's nurses in other facilities that don't have respiratory. What would they have to do then?
They would have to either call the physician and send the patient, have the doctor either come in and assess the patient. If the doctor couldn't come in, they would have to send them out to the hospital, back to the emergency room to be treated. Any type of sending the patient out is a stress for them. Just being the first day that we get a patient in from the hospital, we pretty much just like for them to chill because the transport alone is, for some of these patients, a huge ordeal.
I want to back up, and I hear the word COPD so much, but I don't really know what it stands for.
It's chronic obstructive pulmonary disease.
And
basically what it is you can get the air in, but you can't get the air out.
You get the air in, but you can't get it out.
You take a COPD patients, they breathe, and their airways are constricted, and there's, inflammation and just scar tissue. So you and I breathe normally, and then we'll sigh. That's just nature. That's built into us from birth. But a COPDer, you may see them, they may take a deep breath, and half that breath may come out. And then they'll take another breath, and then only half of that breath comes out. So now you're stacking the breaths on top of each other, and then they can't get a deep breath because their lungs are already hyperinflated. So when that happens, it stretches your lungs. And when you do that over a series of years, then your lungs stay hyperinflated. So it makes it more and more difficult for them to breathe. Their biggest complaint is, I can't get a deep breath in. Well, the reason they can't get a deep breath in for a COPD is because they have so much air already trapped there.
Amazing.
Whereas asthmatics, it's more of a constriction. You have an allergic reaction to something,
Cats.
trees, allergies, cats, dogs, whatever. And then you hear the wheezing noise.
Yes.
A lot of times that's heard on inspiration too. Whereas COPDers, majority of them are expiratory. You'll hear that noise when they exhale, but you can get it both.
So, how did this come from smoking?
Sometimes. A lot of people, yes, smoking contributed, but you'll have COPDers that never smoked in their life. They may have been, their work may have put them in contact with asbestosis. They could have been construction workers. I had a patient not too long ago, was a cabinet maker. Never smoked in his life and couldn't figure out why he had such bad lung disease. Well, all the sanding that he had done over the years of his cabinets and his wood, back in the day, you didn't wear a mask, so we inhaled all that sand. And you get patients that are painters that have painted didn't wear masks back in the day, so they inhaled all the paint.
I always worry when I get my nails done because a lot of those people are using all sorts of chemicals.
And now you see a lot of the nail technicians put the mask on when they start to grind the acrylic because all that's fine dust. They're just inhaling that into their lungs.
Right, and the person I use doesn't even do that. And I always worry about that because if you do 5, 6, 7 people a day, that's got to be causing some problem, isn't it?
Yeah. Oh, yeah. I mean, that was another reason that I wanted to do respiratory therapy. I was born in the Appalachian Mountains of Kentucky, and that was coal mine.
Accent.
I've been in Florida since '84, but coal mining was the primary occupation, and so black lung was prevalent, and it was very prevalent in my home. My grandfather, my grandfathers, my father, my uncles, they all worked in the coal mines. And they got black lungs. So I was familiar with, lung disease and what I saw them go through from working in the coal mines for so many years. So that was another reason that I liked
Oh, yeah, I can hear that now coming out. Well, Rich, getting back to going to Whitehall, so respiratory therapy is extremely important, but you have so many other therapies, too, right there. Why don't you tell us about a few of those?
Your physical therapy, your occupational, your speech, your wound care we have, activities. We have a lot at Whitehall.
Yeah, and that's very, very important because it's almost like a campus.
Yeah, all in one. We have everything you need right at Whitehall.
And so, I told you this before when you were on the show, that I had a torn meniscus. And, of course, I was at Whitehall doing your physical therapy, and I really enjoyed that. And then I know that your speech therapy, and we talked a lot about that, is extremely important because and I would think it would affect people with breathing and therapy to have, if they can't breathe properly, they're not going to be able to speak properly.
Basically, with speech therapy, they're dealing with patients that have swallowing issues, either from stroke, that type of thing, or weakness, just general weakness in the elderly of their muscles in their throat. So different textures and that type of thing, it's hard for them to swallow. So they come and eval. Where I work closely with speech therapy is when we have tracheostomy patients. When the patient comes in with a trach.
Why don't you explain what that is? I know those words are
tracheostomy
common.
Patient is someone who actually has an airway that is implanted in their neck. It's an artificial airway, either from inability to be able to breathe through their nose or mouth. A lot of people with throat cancers, esophageal cancer, that type of thing, they have the artificial airway placed in their neck, which makes it very stable for them and a lot easier to care for.
Then the machine is there breathing for them through this?
No. A lot of the tracheostomy patients breathe on their own, unassisted from any type of artificial machine. They're just using that as their airway instead of their nose.
Oh.
You're literally bypassing their nose and mouth and making an airway that is below their vocal cords.
Okay, so they have an incision in their throat, but
and they have a plastic trach apparatus that goes right into their trachea.
Trachea.
That allows them to breathe.
Huh? And they sleep with that? I mean, they have
It
to.
remains
everything.
there until you can prove that they can continue to breathe without it. So there's a weaning process, and we do that at Whitehall as well.
There's so many parts of this. Most people would not know that. I didn't know a lot of things you're telling me. So it's really a very serious disease when you have pulmonary disease.
Yes, it can be very serious and very debilitating.
You know, I just recently saw a movie. I don't know if you saw this yet. With Harkin, you know, the ALS patient,
yes,
and the breathing, you know, was the key.
Yeah,
and so you realize that, but he has all sorts of machines, everything around him making this happen, and I'm sure you've had some people who've been in. I mean, pretty serious.
We've dealt with some residents. Well, I dealt a lot more in the hospital on the breathing machines than I do because we do not take ventilator patients at Whitehall, but we do take tracheostomy patients.
What's the difference?
The ventilator patients are attached to an artificial respirator. It is a machine that breathes for them.
Well, that's like when I was volunteering in the 1970s for a woman in an iron lung.
Mm-hmm.
And I had a wonderful relationship with her. She had been in an iron lung for 30 years.
Yeah.
And I was always amazed at how that worked. But she could move her head. She just couldn't move anything else.
Yeah.
And it was a breathing machine. But you'd be interested in this. It was in Minneapolis. They actually taught her how they called it frog breathing. She could push out the breath, but she couldn't ever take it in. And while she was awake, she could do that, and she didn't have to be in the iron lung.
Right. Yeah. Well, they have a lot of that nowadays, too. Biofeedback. They're teaching patients to use their neck muscles to, like you said, to exhale, and they'll bear down with their neck muscles, and you'll see the very enlarged neck muscles, but they can watch themselves run on the biofeedback machines so they know when they're doing it correctly. And it allows them to be off the breathing machine for the day, and then they go on at night to rest.
See, Rich, you never realize when you asked Rena to come on just how big this is.
I told you she was fabulous.
Oh, she is. She's knows so much,
smart.
doesn't she? Yeah, and she just, left kindergarten shortly, right?
Yeah.
Yeah, I wish.
No, but that is really great. And so, are you getting? Is this a common field for people? You getting a lot of people in this field coming in?
Yeah, you see, there's several colleges around the area. One in Broward, one in Palm Beach, that have a respiratory program, and they it's a 2-year program. Basically, with nursing, 2 years, you can be a CRTT, which is a certified respiratory therapist, and then you go on and complete your degree, and you can be a registered respiratory therapist, which is comparable to LPN, RN. We have CRTT and RRT.
And when you think about it, the last thing a person does before they die is they stop breathing.
Yeah.
So it's we don't even think of it's not the heart, it's really the lungs, really the breathing that stops.
Yeah. Respiratory is a lot of times respiratory's there when you take your first breath, and we're there when you take your last one.
That's good. I hadn't thought about that. That's right. The first one and the last one, right? But so many people wind up at the very end when you see they're just, and they want water, but you can't give them water because it's going to go into their lungs. And that must be very difficult. I mean, I'm sure you've been in those situations where you have to say no, and the family's upset, and nobody understands that they.
Well, that's where my role comes into play a lot too, is to explain it to the family in the terminology that they can understand. I can talk big fancy words and sound real professional, but if you don't know what it is I'm saying to you, that doesn't help you deal with the situation that you're in. So I try to talk to them on their level and explain it to them in the way that they can understand. So, you're not only caring for the resident sometimes, you're caring for the resident and their family. Well,
this is a great discussion we're having, and a great education from Rena Shannon. And she is in charge of respiratory therapy there at Whitehall, Boca Raton. Let me give you a phone number to call. If you can even be an outpatient for respiratory therapy. You don't have to be someone in there. You just have to have a doctor write a prescription. And you may want to come in if you're having some very serious lung problems, or maybe a lot of congestion. And I'm sure that Rena would have the magic touch for that. The phone number to call is 561-392-3000. Write the number down. Don't rely on your memory. Write it down. Put it on your refrigerator door. It's 561-392-3000. You never know when you may need it, or a friend may need it, or a family member. But if you just received your new Boomer Times, you can see the article written on page 23 in the January issue. And, of course, Richard Dufour has been here. He was smart enough to bring in Rena Shannon. He's in charge of marketing, and that's probably what this is all about. When you go out and you do marketing, it isn't really talking about how beautiful Whitehall is.
It's an education.
It's talking about what happens inside there, because most people, they drive by, Richard, and they have no idea what's in there. And by the time they have to come in, a lot of times they really can't appreciate it. So we always suggest that people go for a tour, right?
And we have many tours.
And what happens when someone does come in on a tour? I mean, what do you show them?
We show them everything. We show them their rooms. We show them their therapy. We show them the nursing station, our patio, our market square, our beauty salon, our ADL suite. We show them everything because we want them to be comfortable when they arrive. They kind of have an idea where everything is, who everyone is. We introduce them to all of our department heads, the nurses. I introduce them to Rena. It's an important process.
And so do you switch? Let's say someone comes in for your rehabilitation therapy. They have, hip, knee, something. And they just can't seem to go home. Is that then when you introduce them to the residential side of Whitehall?
We do. We can do that as well, or we can maybe set them up with private duty or a companion.
I mean, going home and having
Right.
that. But I think in respect where people do go to live there is when they don't really have anybody to watch over them. Even
Correct,
if they
right.
had someone who was a companion, I think they still need to have someone managing that whole system.
Right.
But if you're at Whitehall, that's what they're buying into, isn't it?
Right. That's what we do. We manage their care for them.
Yeah. And, we have so many baby boomers today who just are so unaware of what their parents need. And they, unfortunately, they don't live here and they mean well, but they have no idea of what the needs are. And until something happens, when someone slips and falls or someone gets lost or something. And I hope that and I know you do support groups there at Whitehall. You need to spend time on education with people who really want to know, well, my mother's not thinking the same way. She's not this or that. They need to really have people like yourself and Rena and others who really can sit down with them and explain what's going to happen.
Right.
And have you prepared this?
That's what we do, a care plan. And Rena can talk about what a care plan is and how does it all work.
We meet with the family and the resident. We try to meet with them within the first 3 weeks of them being at Whitehall. And we explain to them each department is represented. Respiratory's there, nursing's there, dietary, rehabilitation, activities. And we all meet with them and start to have a discussion about how well they're progressing. What do we think is going to happen? Are they going to be able to go back home? If no, we don't think that's going to happen, then we introduce the family to an assisted living suggestion. If they're beyond so debilitated that they can't even do assisted living, then we start talking to them about long-term care placement. And it's a very emotional and life-altering time for not only the resident, but for their family members. So social workers, we have our social services department that's there that really works hand in hand with the families. And they're there as a support system to them because sometimes they need almost more support than mom or dad does because they're at Whitehall and we're caring for them. And they're out there and they have no idea what's going on. And they're panicking because everything has changed. And they're also at an age when they're working and they have kids and they're trying to balance the world all at one time. So sometimes social services is more for the family at some point in time than they are for the patient.
Yeah, glad you brought that up. Social services is so important to have. I even know of a lawyer that he's an elder law attorney, and he has a social service person, a social worker who comes in and talks because you need it. It has nothing to do with law, but it has to do with,
Counseling.
It's a counseling. Exactly.
Yeah.
So it's been great. I've learned so much from you, and I am so glad that you were able to come in. So I want to talk again about how people can get in touch with you. This is Rich Dufour, Dufour. He's in charge of marketing at Whitehall. He's the marketing director, actually. And the office phone number is 561-392-3000. And if you want to talk with Rena Shannon, you just can call that number, and then you can ask and see if you can talk with her. And the most important thing to know is you don't have to go and live there. You don't, as a resident, you don't even have to be in the rehabilitation center. They have the services, and it's called outpatient. And you just have your doctor know. And the other thing I must say is don't let your doctor drive your car. And I mean, don't let them drive your body. Because what happens is they have special people they know at certain places. But Whitehall is right at the top. And if they haven't been to Whitehall, don't let someone else tell you where you should go. You can go anywhere. Isn't that true, Rich?
It is very true.
You have to make sure that you're driving your own life. And I think it's really important. So we appreciate your being here so much, Rena. And thank you for what you do for people who need you. I really love people like you.